Hello and welcome. My name is Bailey Gibbons and I am a Compliance Assistance Coordinator with ADEQ's Drinking Water Monitoring and Protection Unit. Today I will be providing a tutorial on how to complete a Consumer Confidence Report, or CCR. CCRs are required from all community public water systems, or water systems which have a minimum of 15 service connections or serve a daily average of 25 or more customers. And for community water systems, this is going to be the same customers year-round. In this tutorial, I will go through the ADEQ provided template for the CCR report, as well as some resources on how to find the information that goes into the report and where you can reach out for questions. So firstly, I want to direct you to our website, azdeq.gov/forms. This will fast track you to all of the drinking water compliance forms. You can see here under this tab. And right at the top, you'll see the Consumer Confidence Report forms, both the mailing certification or mailing waiver, which will be due after you've distributed forms CCR reports to your customers, and the Consumer Confidence Report template package, where you can find both Word and Adobe PDF versions of the ADEQ provided template. So here is the ADEQ provided template for CCRs. This is not a required template. However, it does include all of the required sections and information. So I highly recommend using it at minimum as a guide as you complete your CCR. So at the top, please make sure that you fill in the appropriate year. This is going to be for 2023. We're in 2024 right now, and you're filling out the report for the previous calendar year. So these reports are only due from systems that were active for the entire previous calendar year. If you are a new community water system and you were activated midway through the year, your first report won't be due until you have been active the entire calendar year. If you're using the ADEQ provided template, please remove all of the blue text that you see before providing this report to your customers. This is just instruction text. So in the water system information, you need to fill out your water system name, an ID number beginning with AZ04, a contact name and title, phone number and email address for how to reach the public water system. If that's different from contacts on how to learn more or for public participation, please be sure to include that specific contact information for the public to reach out for meetings or decisions affecting their water quality. The next section is a drinking water source. These two statements are required statements as written by the EPA describing different sources and what might be in them. And then our water source, you're going to fill out whether your system uses groundwater, surface water, or groundwater under the direct influence of surface water. You're also going to fill out the specific name of your surface water body or groundwater aquifer or watershed. Consecutive connection sources. So if your water system buys some or all of its water from another water system, you need to provide the name of that wholesale water system that you buy water from, as well as provide that system's CCR, or you can incorporate their detected contaminants data into your CCR. If you are a wholesale water system, so you sell water to another water system, you need to provide all of your data for the CCR to your buying systems by April 1st of each year. If you are a buying system, make sure that you reach out to that system you buy water from to get that data if you haven't received it on time. If you do not buy or sell water to another system, you can remove this section entirely. I'll show you here. You can just delete it out. Drinking water contaminants. These definitions need to be included as written, as do these statements about vulnerable populations being particularly susceptible to certain contaminants in the water. Next is the source water assessment. So if your water system was active in 2002 or prior, it is likely that ADEQ conducted a source water assessment and has provided you with either a low risk or high risk designation. You need to select which one is appropriate based on how your water system has been categorized and include the statement that is applicable. If your water system did not receive a surface water assessment, you will include this statement because it was either inactive or the public water system did not exist at the time. If another entity completed your source water assessment other than ADEQ, please provide that information for the assessment results as well. The definitions section. These definitions are required to be included as written. If you do not use a term in your report, such as if you had no level 1 or level 2 assessments, you can delete those definitions out. However, things like maximum contaminant level goal, not detected, and all of these acronyms do need to be included no matter what. For the lead information statement, this is required whether or not your system detected any lead in the water. So you need to include this statement verbatim and make sure that you insert the name of your public water system in here. This next section on regulated contaminants and unregulated contaminants, water quality data and detection, I'm going to show you where to find this information so that it most closely matches and is as accurate as can be. So I will just toggle over here. For those of you who might not have Drinking Water Watch already bookmarked, I will show you from the ADEQ homepage, which is azdeq.gov, how to find Drinking Water Watch. So under the water section, you can scroll down to Safe Drinking Water. And here you'll see the Safe Drinking Water Information Information System, or SIDWIS. This is the Drinking Water Watch database, so you can click here, and that will take you right to this homepage. Now, rather than typing in your water system number, you're going to go to Review Consumer Confidence Data. Here, you will type in your water system number. I will just pull one up from my recents. And generate report. Make sure that it is set to 2023 for your most recent report. And that will give you a downloaded PDF. This will provide most of the information that you need for your detected contaminants and violations. So as you can see here, it is set up in the same format as the CCR template that we have provided with your results and the date sampled. So you'll see here that this says 2021. If you did not sample for a contaminant in 2023 or the most recent year, but the most recent year that you sampled was within 5 years and had a detection, then you need to include that data up to 5 years old. If your most recent sample was a non-detect, you do not need to include it. We'll scroll down a little bit more here, and you can see it is only going to provide the detected contaminants. Everything else that was sampled for is considered non-detect, or it was not sampled within the last 5 years. So this is going to be in the same format as our template, including the likely source of contamination, so you can copy this information directly and put it into your report. Now I'll go back to our template. So total coliform sample positives are no longer required to be included in CCRs. However, any E. coli positives or fecal indicator positive samples do need to be included, and the positive sample month and year, along with whether or not there was a treatment technique violation, which for E. coli or fecal indicators, that would be yes. If your system uses surface water, you need to report your total organic carbon data and your turbidity data, as well as the health effects and definition language for both total organic carbon and turbidity. If you are not using surface water, you can delete this section entirely. Just highlight it, hit backspace, and then you can right-click and delete the extra rows that do not apply. The same goes for all other non-detected contaminants or not applicable sections. If you choose to include not detected contaminants, you need to put them separately from all detects. This is going to lead to a lot longer report and can be more confusing for customers to read. So I would suggest, if you would like to include any non-detects, you use a short statement that says something along the lines of, the following contaminants were also tested for and not found in your water. Something like that is going to save you a lot of space and be easier to understand for your customers. If you are a system that regularly disinfects, you will include your chlorine, chlorine dioxide, or chloramine data and the range of samples. And if you're disinfecting, you're also sampling for disinfection byproducts. Now, if you are just taking annual samples of these disinfection byproducts, you would include the highest levels detected, or the detection in 2023. If you are on quarterly sampling for either of these contaminants, you're going to include the running annual average, and you're only going to include the location that had the highest running annual average. So calculate your running annual averages on a quarterly basis at your different locations and only report the highest one. Unless you had multiple locations that had MCL exceedances, in which case you would report all locations that exceeded the MCL. For range of samples, low to high, that is going to be the lowest of low and the highest of high. So if you are taking quarterly samples at several different locations, it's going to be your lowest sample and your highest absolute sample. For sample month and year, if you sample annually, put in the month and year, but if you sample quarterly, you can put quarterly. For lead and copper sampling, you're going to be reporting the 90th percentile, and as I showed you in the Drinking Water Watch generated report, it will provide you with the 90th percentile results and the number of samples that exceed the action level. All the same goes for radionuclides if you had any detections. And if you are on annual sampling, just report that sample. If you took quarterly sampling for anything, you will report the running annual average. Next up is inorganic chemicals. This is a pretty long list, so if you just had some of these that were detected, only include those and go ahead and delete out the lines of all of the non-detected contaminants like so, highlight, backspace, and then go ahead and delete out those lines. One thing I will note that the Drinking Water Watch generated report does not pull is sodium data. So make sure that you are reporting the amount of sodium that was found in your water for the previous calendar year. Health effects statement for arsenic and nitrate are both required if either of those contaminants were found above half of the MCL. So if arsenic was detected above 5 parts per billion or nitrate was detected above 5 parts per million, you need to include these health effects statements. Synthetic organic chemicals. Many systems will have mostly non-detects. If there were no detects, again, do not include this section at all. You can choose to list the contaminants that were sampled for, or say something along the lines of 30 additional synthetic organic contaminants were tested for and not found in your water. The same applies to volatile organic chemicals. All right, so moving on to unregulated contaminants. If your water system is part of the EPA's UCMR, or Unregulated Contaminant Monitoring Rule program, then you need to report any detections for sampling that occurred the previous calendar year. So any 2023, in this case, contaminants that were tested for, which for UCMR is going to be the 29 PFAS compounds and lithium. And you need to report your data if there was detections and the minimum reporting level. This has all been filled in for you on the form already. For PFAS, ADEQ also sampled and has sent out an email for all systems that had this sampling done. If you had PFAS sampling done voluntarily at your system and had detections, then here's where you would fill in the highest level that was detected of these contaminants and the range of all samples if you had multiple sampling events happen. If you had PFAS sampling, but there was no detections, you can either delete this part entirely, or you can choose to leave it in and show your customers that while you sampled for PFAS, they were all non-detect. Here is for UCMR systems. If you are not part of the UCMR 5 program, you can delete this section entirely. So next, this only applies to surface water systems, but if your system tested the source water for cryptosporidium and detected cryptosporidium, you need to put in the detected number of detected samples and the total number of samples taken in that year. You also need to include the health effects language for cryptosporidium. If you sampled and did not find any cryptosporidium, or are not a surface water system, or did not sample for cryptosporidium the previous year, you can delete this section. Lastly is the violations section. So all violations related to maximum contaminant level exceedances, or MIRTLE exceedances for chlorine, action level exceedances, treatment technique violations, or monitoring and reporting of water quality data need to be included. So late submission of data to ADEQ also needs to be included in your violations section. So under violation type, you would either say missed monitoring, MCL exceedance, late reporting, sort of the general overview of what happened. And then in the explanation in plain terms, what happened. And if it was a missed monitoring treatment technique or an MCL violation, you need to include the EPA approved health effects statement for that contaminant. This is going to be the same health effects statement as what you see on the public notice that was required for that violation. If you are reporting a late reporting violation, you do not need to include health effects language. For time period, we're looking for the month, quarter, or if it happened several times, just include when that happened during the year and what corrective actions have been taken. If it is something like late reporting, you can say submitted the late data. If it is missed monitoring and you resumed monitoring the following month, something like that, but just in plain language, what your system has done to correct that violation or what they'll be doing to prevent it in the future. Assessments for the revised total coliform rule. If your system was required to complete any level 1 or level 2 assessments in the previous year, you need to disclose that, and you need to disclose how many you completed on time or did not complete, as well as how many corrective actions were required and how many were completed. If your system had to complete an assessment due to E. coli, you also need to include this health effects language about E. coli. If you failed to conduct any assessments that were due, you need to report that as a treatment technique violation and explain what happened. So that is it for the ADEQ provided template, and I will go through a few more resources on where to find different things. So again, just an overview on how to get to the Access database for CIDWIS to find that data. And this is where you will review your consumer confidence data to get the report that looks like this. As you can see, this report also contains all of the violations that you need to include, and it will give an explanation. So use these generated reports to fill in your CCR. Another way you can look at your violations and detections is just on the basic Drinking Water Watch database. You can type in your water system number. Again, I will just use one from my recents. And if you go over to violations/enforcement, you can click on violations and make sure you're toggling over the compliance period begin date and end date to be the most recent first. So you can see only what occurred in the year that you were looking for the CCR. So again, all of this should be coming up on the generated report for you. But if you want some more information about what happened and whether or not compliance has been achieved, so whether or not these violations have been closed, you can go here and find more information there. All right, so next, this is just back to our forms page. Just as a brief reminder, azdeq.gov/forms, and under drinking water compliance, you can find all of the CCR forms right here. So I'm looking at the mailing certification and mailing waiver. So once you have distributed the report to your customers, this is due by July 1st. All customers and ADEQ must have received the report. Once that's been done, you'll put in the CCR distribution date, the calendar year, your water system name and number, whether you are part of Maricopa County, Pima County, or otherwise select ADEQ as your regulating agency. And if you have over 10,000 customers, you are required to fill out the mailing certification form. You can distribute CCRs by mail, email, or a combination of the two, and you can either send out the report in its entirety or send out a direct URL for where the CCR can be found on a publicly accessible website. Make sure you list that website if that is the option that you're choosing, and list which good faith efforts you have used to reach your non-bill paying customers. So this is things like customers that live in apartment complexes that only receive one water bill, people that are drinking water in community centers that may not be the billed customer and may not receive the CCR. So some ways that you can reach those non-bill paying customers could be posting the CCR on the internet, to social media, publishing in a newspaper, delivering multiple copies to community organizations or to single bill addresses such as apartment complexes. And then if you have over 100,000 people in your system, you must post the CCR to a publicly accessible website and make sure that you list that URL. Once this has been completed, whoever can certify that the information is true and accurate, print and sign and leave your contact information. This does not have to be the water system owner. A lot of water systems may have management companies that handle the mailing. Whoever can certify that this information is correct may complete this and turn this into ADEQ. If your water system serves under 10,000 people, you do qualify to turn in a mailing waiver instead of a mailing certification form. If you are choosing to do that, there are some additional requirements. You must inform your customers that you are not automatically providing copies of the CCR, but you must make copies available to the public upon request, and you must let them know how they can request a copy. Additionally, if your water system serves over 500 people, You must publish the entire report in at least one local newspaper. You must keep copies available for the public, and you must give them information on how they can request a copy. In addition, you still have to complete at least one of the good faith efforts required to reach non-bill paying customers. So using social media or posting in local areas, posting the CCR up in public places, something like that. Right, so lastly, I'm just going to take you to our homepage, azdeq.gov, where you can find Compliance Assistance Coordinator contact information to reach us. So under Permit/Compliance, Compliance Assistance, go down to Drinking Water Systems and click on Public Water Systems. And here you can toggle over to learn more about the Consumer Confidence Report or any of our other specific rules. But if you click on Contact on the right side of the page, Compliance Assistance Coordinators find by county. I recommend that you bookmark this page, print it, store it if you do not know who to contact for your water system, or you are completing consumer confidence reports for multiple systems in different counties. These are going to be the best contacts by county for each water system. If you're not sure what county your water system resides in, it is the first two digits after the AZ04. So if you had a water system that had a PWS number of AZ0406 number, that would mean that is in Greenlee County, and Carling Olson would be your contact. So please contact the appropriate Compliance Assistance Coordinator with any questions and to submit your CCR and mailing waiver or mailing certification. You can also send those to CCRRule, that's RULE, at azdeq.gov. That is our monitored inbox for all CCRs, and we should be able to answer any general questions and take submitted reports. Thank you and have a great day. I hope this was helpful, and please reach out with any additional questions.